So obstructive sleep apnea, and that's what usually what we're talking about. There's central apnea, in which your brain doesn't tell you to breathe enough. That's far less common. And then there's obstructive sleep apnea, when you're actually breathing, but you have an upper airway collapse, which stops the flow of air. So it's not getting past your throat or getting past your neck. Air isn't getting into your lungs. And as a result, you're not getting oxygen properly into your blood, into the rest of your body. Your oxygen levels can drop quite low sometimes with obstructive sleep apnea. And then there's a few other things that are going on as this happens. You can have spikes in your blood pressure as your chest is working very, very hard to breathe in air and create a lot of pressure in your chest, which puts pressure on your heart, and you could have spikes in your blood pressure. Um, all of these things can be damaging. And in addition to the obvious long-term damage of having low oxygen levels whenever you're sleeping or spikes in blood pressure that can persist even when you're awake, when these things happen, your brain wakes up a little bit. Sometimes patients are aware of it. Sometimes they're not aware of it. Sometimes they're aware of it and they attribute it to something else. Oh, I had to wake up and pee. But they are having arousals several times an hour, maybe dozens of times an hour, and they're having fragmented sleep. And that's going to affect mood. That's going to affect memory, thinking, cognition. That could put people at risk of dementia later in life. There's a lot of data on that coming out, particularly in women. And so it is more than just snoring, and it is more than just having fragmented sleep. Obstructive sleep apnea is essentially a systemic illness.